Namaste everyone. Welcome back to our live stream sessions. So, as I informed yesterday, today is our topic to discuss is daily regimen. That is, in our Ayurveda we say Dinacharya. What all tips or what all steps we should follow in our daily routine life, not only in particular diseases or not only in particular day. Yeah, on daily basis from morning when we get up till night when we sleep, till that time, whole this day, what all steps we should follow so that we will be healthy. We'll see. So first point, that is, what is this daily regimen? As I explained, these are the daily activities from the time we get up and till we sleep at night. But what these will do, what these daily regimens, tips or activities will do for our health? That is, it will prolong the lifespan, obviously, because we will be prevented with diseases. Obviously, so these activities will prevent the disease and it will give long lifespan without any health issues, and maintenance of hygiene maybe, or brightening the indriyas, like indriyas means sense organs. It will brighten our sense organs, and it will strengthen our body, and it will promote our health and longevity, obviously, and keep our mindset peace without stress, and overall we will be stable, we will be healthy if we follow all these daily regimen activities. So today we will see what is this daily regimen activities, what all steps we will follow, and how they will give result in our daily life, we will see. So first we will see what are the what all activities we should follow to maintain this daily regimen. The activities, what all these activities? In our Ayurveda, they mention these as Dinacharya. Dinacharya means whole day charya, activities we do. Especially they mentioned as, but here I want to mention one thing, that is, when I start explaining about this daily regimen activities, you all maybe you all will think, what is this activity she is saying that we are doing in a routine daily basis? Our ancestors were following this regularly on daily basis, but nowadays, has technology developed and has our stress and activities running towards the job developed, we are reducing these activities. We all know these activities, but we don't know the benefits of that. Especially now new generation people, what they feel is, if their grandmothers or mothers explain about this, or if they say do these activities, they will neglect it, they will ignore, and they will say these all are your day's activities, we are not going to do this. But that only today we will see how these activities, daily routine activities, will benefit our health, and in which way, and what all benefits we will get by these dinacharya activities, we will see. By explaining this, I am getting one proverb. Nowadays technology people, like new generation people, what they do, actually these all dinacharyas activities are our ancestors, what our ancestors were doing. The example is, now in comedy reels and all, we will see one person, he was riding a bicycle, he got bored of bicycle, so, and he was feeling stressed, so he took four-wheeler or moved towards the technologies. He started moving in a car and started sitting in a place. So obviously due to that he got ill health and weight was gained. Again he went to gym to reduce his weight, and again in gym what they will give, again they will give bicycle. Like that our life or the days happen now, because these all activities our ancestors explained, but we were not aware of benefits of it. So we moved towards the technologies and moved towards the new generation. We left all these activities aside, and we are moving. But again now what will happen, our obviously our health will get suffered by it. Our health will we will get ill health. Again we will go to doctors. Doctors, what they will advise, again they, especially our ayurvedic doctors, again they will advise these our ancestors tips only. So when I explain now, you will get to know what all tips or what are the steps. We will see what are these activities we should follow in a daily regimen. That is, first basic thing is Brahme Muhurte Uttishte. That is awakening early in the morning. And next one is Achamana. This Ayurvedic terms, what I am saying is about Ayurveda. In Sanskrit, we will say this Ayurvedic terms, and I am saying the terminology in a modern. That is Achamana. That is sipping up of water. Danta Dhavana, nothing but brushing our teeth, and Jiva Nirlekana, nothing but tongue cleaning. Gandusha, nothing but gargling. Kavala, that is mouthwash. Anjana, that is nothing but calorium, kajal, what we apply. And next thing is Dhumapana. Dhumapana is smoking. Nasya, that is nasal drops. Exercise, that is Vyayama. And Abhyanga, that is massaging our body. And Udhavartana, it is a form of Abhyanga only. And Snana, that is bath. And Rakshogna Karma, that is protective measures. In these protective measures, we have some subtypes of Rakshogna Karma. These all are the daily regimen tips or activities which we want to follow on daily basis. Now you got to know what I was explaining before, right? These all are activities what we are following. But in these, some like maybe Gandusha or Dhumapana or Abhyanga or Vyayama, in these some tips we left behind and we are moving towards one thing. And another thing, what we are using now for these all activities are preventive based or chemical based things which we are getting in market for advertisement or for their benefits, right? But these all activities are acharyas explained according to our natural Ayurvedic herbs, or by using a medicated oil or medicated drug, they were using this. So now we will see what are these activities. Now we saw what are activities of Dinacharya. Now we will see the benefits of it. These all activities you all were knowing, right? These all on daily basis we will do it, one or other, by skipping one or other or by doing everything we will follow in our daily routine life, these all. But we don't know what all benefits we have in by these activities, right? So today I came here to explain the benefits of these activities, what we are following, and why our ancestors particularly started these activities, we will see. So first thing is Brahme Murte Uttishte, as I said. That is awakening early in the morning. What is this Brahma Muhurta? Brahma Muhurta means the time before the sunrise. Our ancestors were saying this, right? We should get before the sunrise. Nothing but why we should get up. Nowadays it is totally opposite, right? We will sleep during the sunrise and we will get up later when sun comes on our head, right? So we should not do this, because we should get up early in the morning, that too before sunrise. We will see what all benefits we will get by getting up before the sunrise. Obviously, as before the sunrise, usually during this time, environment will be very clean without any pollution, right? So along with the clean air, pleasant atmosphere, absence of noise, the morning rays of rising sun, these all will give positive results on our mind and body both. By getting up early in the morning, awakening before the sunrise, and doing our daily activities like maybe Vyayama or other activities, or our daily routine like snana, brushing, everything, the early morning sunrise will give positive result on our body and even on our mind. So we should get up before the sunrise and we should start our day. In routine days also you can see, if we get up early in the morning, we will be fresh and active whole day. That only if we sleep for longer duration, obviously our mind and body both will be dull. You can experience it. So first thing is you should get up early in the morning before the sunrise. Next is Achamana. Achamana is nothing but sipping up of water. Obviously we will do this, right? Immediately after getting up, what we will do? We will clean our face and we will clean our mouth by sipping up of water. But particular procedures we have for this, how we should do, what we should do, everything. Obviously, we will be following it. But if I explain all the procedures, it will be very long time to cover it. So I am explaining only benefits. So what are the benefits of sipping up? Why we will clean our mouth by sipping water? Obviously, to clean the virus or contaminated present in our body. We will be sleeping for longer duration, so we will clean our mouth, or we will to maintain hygiene, we will clean the mouth. That is the benefit. And next thing is, what all the benefits we have by danta dhavana. Danta dhavana is nothing but brushing our teeth. Brushing our teeth, obviously we will do, everyone will do daily, right? But what all benefits we have from this? Why we should do? One thing is to maintain a hygiene, because obviously after getting up, every virus or any bacteria or microbes will be present in our mouth, so we will clean that. But usually doctors will advise to brush your teeth twice a day. Why twice a day? Because as we say early in the morning after getting up, to clean our mouth, to maintain hygiene, and in night whatever we had of food, it will be accumulated in our teeth and it will be reason to get caries. So they will advise to clean our teeth and sleep, so that there will not be any accumulated food items or diets in our mouth, and it will not create a caries. But what benefits we will get from this? One thing is hygiene. It brings about freshness and takes away bad odor, and takes away the coating on teeth, and it produces elevation of kapha. Nothing but whatever kapha accumulated in a sleep or in the early in the morning, it will be elevated out, and clears the mouth and desires for food. These all are the benefits from the brushing of teeth. And here one thing I can add a point is, you should choose a paste which is comfortable for your teeth and comfortable for your health, and especially the fluoride content. The children below 2 years, no need of any fluoride content, so their paste should not be containing fluoride one. And 2 to 4 years kids, they need only once a fluoride content paste, not more than that. After 4 years, twice a day, as we know. But for some kids, like for example, I can say the kids who are 5 to 10 years, or 3 to 7 years, who will not be having falling their milk teeth. We have two types of teeth, right? Milk teeth and permanent teeth. In after 7 years, these milk teeth will fall off, and the permanent teeth will get erupted. In this age, before 7 years, if the children are having caries due to more number of having sweets and chocolates, there is no need to fear, parents. You can brush your baby's or child's teeth thrice a day, which is minimal content of fluoride is present, or no fluoride is present. From that paste, you can brush your teeth thrice, your kids' teeth thrice a day, so that they will not get pain. Obviously, because rather than treating a milk teeth, obviously it will fall after 7 years. So there is no need to treat a caries milk teeth after 7 years. However, that milk teeth will fall and permanent teeth will come. But here you have to maintain a intake of sweets and chocolates of your kids, and you can brush their teeth thrice a day. And next one is Jivva Nirlekana. What is this Jivva Nirlekana? That is tongue cleaning. Obviously, we all will do, and nowadays we are getting so many products, like different types of products to clean our tongue only, right? So why we should do this? It removes bad taste, one thing, and bad odor from mouth it will remove, and it will cure the stiffness of tongue. It will relieve the tongue muscles, and it will promote the good taste. So we should do tongue cleaning after brushing our teeth. Next one is, our Acharya has explained Gandusha. What is this Gandusha? Gargling. Gargling, obviously we will do. we all will do. But which gargling we will do? In this gargling only we have Gandusha and Kavala, two types. That is the what we are doing, washing our mouth is Kavala. Minimal quantity of water we will take and we will clean our mouth with the some movements in a mouth. That is Kavala. That is one type of mouth washing only. But this Gandusha is particularly for like medicated oil they will fill and fully mouthful without any spaces they will fill, and they will keep that medicated oil till watering of eyes or till the tolerating capacity of a person. Then they will spit it out. This is the procedure of Gandusha. What all benefits we will have from this is enhances strength of mandible bone, what we say, and it will give resonance to voice and nourishes the face muscles, and it will nourishes the taste, or it will enhances the taste, and it will prevent the dryness of throat, and it will prevent the cracking of lips. The benefits of this Gandusha, that is gargling. And as I said, Kavala is benefits are same, but in this, whatever after brushing what we are doing is, obviously we are doing only with water, but some of you have mentioned have seen, or have you gone through that doctors will, when you go to the dentist, they will give one mouthwash and they will say keep this in mouth or wash your mouth with the medicine. Nothing but our Kavala procedure only. Our acharyas or ancestors, they were doing with the normal herbal drugs or normal ingredients which we are getting in a home, but now doctors are advising in a product form. That's it. And next one is collyrium, that is anjana, nothing but applying a kajal. Now all may be thinking nowadays girls and women all will do this. What's special in this, right? But why nowadays they are doing for cosmetic purpose or for to look good, but our ancestors explained this in a form of beneficial way to the eyes or beneficial way to the health, like application of kajal. Obviously now we are getting different types of kajal which have preventive or chemicals. We should not use that. Actually we should use a normal homemade anjana. You can use kajal, you can use, or you will get the herbal kajals. Nowadays we are getting herbal kajals also, that you can use. What are the benefits of this applying kajal? That is, by application of kajal, it cleans the human eyes, obviously, because when we apply kajal, as we have the medial canthus, it will excrete all the dust or whatever allergens or foreign bodies will enter our eyes, and it will remove out. So it will cleanse the human eyes, which makes them shine, obviously, by applying. But as I said, it's not by preventive or this chemical based kajal. It will be done by herbal kajal or homemade kajal you can use. Next one is smoking or dhumapana. Now you all may be thinking, all doctors will say to avoid smoking, you should not use smoking. But what this doctor is saying, to use dhumapana, right? So I am not saying about the tobacco smoking. We have the procedure according to our Ayurveda. We have the dhumapana procedure according to more medicated drug. Yeah, that too in particular kapha vitiation or particular dosa vitiation, particular medicated herbs we have. We will say or explain the patient to inhale the smoke of that medicated drug to cure that vitiated dosha. And what this dhumapana will do? I'm saying repeatedly, not dhumapana of tobacco one, which smokers are using. This is the medicated drug dhumapana, the smoke. Or in general, we can say like inhaling the smoke. Or for example, basic is steam. What we are doing, we are inhaling the steam there, right? But we are not using any medicated drugs there. In respiratory allergies, we will use some like Nilgiri Thaila oil we will use, or our normal Vicks vapor we will use. That is nothing but inhalation of smoke. inhalation of smoke in a medicated way is dhumapana, or smoking in a natural way. What benefits we will get by this dhumapana? That is, cures heaviness of head, cures headache in kapha vitiated dosha, kapha dosha vitiated diseases, or half-sided headache some people will get. By that will be cured, or pain in eyes, ear, and kapha obstructing the throat will be cleared, and changing in voice will get cured. Graying of hairs will be prevented, and hair fall will be prevented. Drowsiness, and strengthens the sense organs and voice. These all are benefits of smoking, that is medicated dhumapana. Our next procedure is nasya, nasal drops. Giving the nasal drops. That procedure is known as nasya. What is this nasya? Pouring or giving a 2 drops on each nostril, or dropping a 2 drops of each drop of medicated oil in each nostril is a procedure of nasya. Obviously, we are saying about the medicated oil, but obviously when you go for stuffed nose, by complaining stuffed nose near a doctor, they will explain you to, or they will prescribe you a nasal drops, right, to clear the mucus. That is nothing but, in modern they are using chemical based nasal drops, but here we are explaining a medicated way. In our Ayurveda, we are explaining this on the medicated oil, which will clear the obstruction and which will prevent the respiratory allergies or any head and neck allergies. It will be cured from this nasya. What all other benefits we have from this procedure nasya? That is, prevents diseases of eyes, nose, and ears, prevents white hairs, and hair will grow well by continuously using nasya, and it will cure the stiffness of jaws. It will cure the rhinitis. Rhinitis is nothing but running nose, and half-sided headache will be cleared, and it will enhance the voice, and it will enhance the sense organs, and the person will not be affected with any head and neck diseases easily by using regularly nasya, that is nasal drops. And this, what not nasal drops we should use, you can ask. That is, obviously according to complaints, we will use different types of oil, but in all seasons you will get a anutaila. In Ayurvedic medical shops, you can hear this, or you can get this anutaila. You can use this as a pratimarsha nasya, but particular nasya procedure we have in a different diseases. If you should consult a Ayurvedic physician, they will advise you. But pratimarsha nasya is, we can use this oil on a daily basis, like morning or evening. We can use this on a daily basis. And next is vyayama, that is exercise. Obviously, we know what benefits we have from exercises, right? It will nourish the body, it will give good complexion, enhances the agni, that is digestive power, takes away laziness and tiredness, and purifies the body and enhances the tolerating capacity, and it gives the good health. Obviously, these all we have benefits from our by doing exercise regularly, right? Then next, coming for abhyanga, that is nothing but massage. Obviously, in our ancestors, in our olden days, we can see they were doing oil abhyanga whole body, then they were taking bath, right? But nowadays we are not following this. Only in newborns we will do this, but later we will not do this. But actually it is good for health. By doing this massage to our body, then taking bath, what all benefits we have, we'll see. On daily practice, it delays aging, first thing, and cures the tiredness. Obviously, by abhyanga, we'll feel relief and lightness, and especially vata dosha vitiated diseases will be cured by abhyanga, that is massage, and improves vision, complexion, and nourishment will be done of the whole body, and will luster the skin and strength, obviously due to massaging. And but to get this all benefits, we should do this abhyanga on regular basis. But you may ask now, where will be having time to do this on regular basis? Obviously, working people immediately after getting up, after their activities, they should run to the office or working place, right? So at least if you are not able to do abhyanga or massage for whole body, head massage, ear and feet, these at least these three massages you can do. You can wait for 5 to 10 minutes and you can have a bath. It will give a good result. And in abhyanga only, in massage only, we have a subtype, that is udhavartana. What is this udhavartana? The powder or paste form of abhyanga. In upper abhyanga, what we saw? Oil massage, right? So in this udavartana, either the massage will be done with the powder, medicated herbs powder, or in the form of paste. What benefits we have from this? Blood vessels get dilated and agni will be enhanced in the udhavartana procedure. But massaging with paste, like herbal drugs only, we will make in a form of paste and we will massage the body. These will enhance the complexion, especially in ladies, gives pleasure, clears and lightens the body. These all benefits we have from the abhyanga, that is body massage. The next tip or step which we want to follow in daily routine basis is snana. Obviously, after this abhyanga, everything, we will go to bath, right? What are the benefits of snana? Obviously, this is a daily basis routine, but some people, as I repeatedly I'm mentioning, nowadays, this new generation people, they will not take bath. They will get up late and they will have, they will wash their face and they will run, right? But why you should not skip snana? What all benefits you have from snana? We'll see. Obviously, as I said, if you follow abhyanga, after abhyanga, if you take a snana, then only it will give a good result. After doing massage, if one takes bath, person will be cured of bad odor, one thing, and it will help the body by becoming hefty or heavy. It will cure the drowsiness and tiredness, and some impurities will be cleared, and especially the mind and body will become very light. The person will become very calm and cool. So in daily activities, you can see the differences. If the people is following without going without snana, on the day you can observe, on the day of when you do snana or bath, how you will be felt or how you will be feeling whole day. And when you get up early, do all activities and take bath, and when you go for workplace, how you will be feeling, you can feel the differences, right? And the last step of our this dinacharya is protecting measures, that is rakshogna karma. What are these protecting measures? After doing this all activities, what protective measures you should follow on daily basis? What protective measures we will be having? Actually, according to rakshogna karma, especially according to our Ayurveda or according to our ancestors acharyas, they were saying like wearing flowers or wearing beautiful clothes or wearing the gems will increase our ojas and strength. In especially in village people, especially in Hindus, you can see compulsorily all ladies will be wearing flowers in their hairs, right? But nowadays it became cosmetic, and even the germs is nothing but earrings or necklaces. These also nowadays it became like a cosmetic purpose and fashion purpose. But these all have the positive vibes or positive results in our health, like flowers or wearing a good cloth, attractive cloth, and wearing these gems and all will enhance the activity or functioning of our ojas and strength. So the bad omen or bad vibes or bad results will be far from us. We will be having lightness of body and we will be active in daily routine. One thing. And coming for nowadays protective measures, what all protective measures we can follow to maintain hygiene? Immediately after coming from out to home, you should wash your feet. obviously, because we will be roaming, all the dust will be entered, or the virus or anything like any foreign bodies will be occurred. So immediately after coming, we should change our clothes, cleaning and washing our feet should be done. And another protective measure is normal basic cutting our nails and hair. Why we should cut? Cutting our nails is nothing but maintaining hygiene to prevent contaminated or to prevent the infections, right? We should do this, nothing but protective measure. And wearing a clean cloth, obviously, to maintain a hygiene. And wearing footwear, especially why our acharyas mentioned why wearing a footwear in protective measure is, nowadays we have plenty of, no one will go by walk, we will be having our own vehicles, or the social vehicles we will take, and public vehicles we will take, and we will go. But before, they were using only walking, padayatra, they were doing only to workplace, also to anywhere if they want to go, they were going by walk only. So they, especially they mentioned to wear a footwear to prevent the injuries. And holding a stick, obviously, again, when they were walking, other, like for example dogs, animals were, to prevent the animals or any other injuries, they were using stick. So they mentioned holding stick in a protective measure. And wearing a protective covering, nothing but in obviously in rainy season we will wear raincoat, and in the summer we will use a coat to prevent our skin from injuries. In this protective measure or wearing a protective cover, we can take example as helmet, using a helmet to prevent the injuries on a vehicle when we fell or when we get accident. So these all will come under protective measures, that is rakshogna karma. And in this, one type of dhupana will come in the form of home, that is what we use as homa drugs, or dhupa, what we use on the daily basis while doing puja, we will use dhupa, right? That is nothing but the medicated drugs will be filled, and that with that fumes, the maybe to prevent the environment of a home by the germs or microbes, it will give protection to our body, right? Not only our body, whole health, home environment. So these all will come under protective measures. So these all were the are dinacharyas which we want to follow from when we get up to sleep. What all the activities we should follow on daily basis, compulsorily daily we should do. Obviously, you all were knowing these dinacharya activities, but you all were not knowing what benefits we have from these dinacharya activities, right? So I tried to explain as much I can the benefits you get by these dinacharyas, but our acharyas explained to use particular by using these particular home remedies or herbal drugs, we should do this all. Obviously, in village, people will follow these herbal drugs only, but now we are following what we are getting in a environment, or in a products like what we are getting to use particularly. So this was the topic of dinacharya. If you have any doubts, or if you have any queries about these activities, you can comment in a comment section box. Thank you.